And we are recording. Hello, Samson.
Hey, Aaron.
How are you?
Good. How are you?
I'm doing well. Why are we all coronavirus experts nowadays?
Isn't everybody? Well, I think Bitcoiners are pretty analytical. We're a very analytical bunch and we like to dig into things. And I think that's how come we get into Bitcoin. And when there's a pandemic, we kind of will try to dig into that too and look at the numbers, look at the facts. So I guess it kind of trickles into that too.
Yeah, I agree. I sort of speculated this in my sort of intro talk for the first episode of this series, and I think Bitcoiners are generally pretty good with numbers and sort of exponential growth. They probably understand that a little bit more than average, but also not just taking the expert in quote marks sort of truth or granted. Like they like to actually look at the data and think for themselves and draw their own conclusions. So I think that's why there's a lot of overlap between people that find Bitcoin interesting and this virus stuff.
Yeah.
So thanks for being on the show.
What's the name of the show? Do you have a name yet or
Yes,
no?
the name is the Honey Badger Diaries
Ah, nice.
because we obviously have the Honey Badger of money. And then you have this YouTuber that does a lot of videos on the coronavirus. His name is what's his name? Chris Martenson, I think, and he's been calling it the honey badger virus. So sort of both things are sort of referred to in the honey badger context. So I'm calling it the honey badger diaries.
Okay, nice.
Hey, so you've been watching this virus for a while now, since it was just a Chinese thing, right? So
Yeah.
what I'm doing in this I'm calling it a podcast. I started it as a video series. What I'm doing in this podcast is for now I'm sort of doing this trip around the world where I'm speaking with Bitcoiners in different locations in the world and have them explain the local situation, how local governments are dealing with it, how people, cultures are dealing with it, and then that's sort of how I'm starting this out. And then over time, I'll probably build from there. Now you've been watching the Chinese situation, so I would suggest we kind of start there to explain what has been happening in China.
Sure. So Pixelmatic is based in China. So primarily, I've had to focus a lot of attention on that because we kind of, we saw it coming. We're not at the epicenter. We're largely based in Shanghai, but we did hear rumblings about it in early December, and then in January when it really started getting real. I think we had the official mandate that this is a human-to-human transmission virus, and Wuhan was getting locked down, and well, it was getting out of control then. It kind of got, I think it got locked down in February around the Lunar New Year. And at that time, we had a lot of our staff back home in their hometowns in various places. And actually, one of my staff is from Wuhan, so she had gone back and was, back with her family. And we had to figure out what was happening, what to do with the office when we would reopen the office, how we would handle supplies, because masks were definitely in short supply. So I had to actually send some from Canada back to China. I sent a couple hundred back, and they distributed them, which is kind of ironic because now like it's the other direction. They're sending them this way back to
Right.
Canada because we have a shortage here. But yeah, like I was watching a lot of things unfold on the ground and deciding a lot of the company policy of what to do and what not to do. And you can kind of see the severity of it and the urgency, which is kind of weird because being over here, no one really gave a shit until maybe a month ago, if
Yeah.
that. So it's just a kind of a weird place to be in.
The first month when it was just in Wuhan, basically, I've heard there was a cover up by the Chinese government. Is that true? Do you know anything about this?
Well, I think there was a lot of uncertainty, and there are theories out there that the government tried to cover it up. Doctors were silenced, and I think it's a bit nuanced. Like, when you know that there is a coronavirus and it's happened, and you can sit in your home and watch it from far away, it's a bit different because when you're watching it happen on the ground, I think the risk is like, is it real and is it a panic? So I'm pretty sure that part of it was trying to ascertain if it was a real infectious virus similar to SARS, and if it would be a massive thing, or is it just a false flag? But definitely there's like a lot of uncertainty about what happened with information coming out of China. And of course, there's mistrust in what happens with Chinese news as well.
So what do you think is the case with, what are the facts about the virus as far as you can tell?
Well, it's highly virulent. You can see like when it's in close quarters, like you're stuck in a cruise ship or on a bus, it can transmit very rapidly amongst the population. I think it was characterized initially as just a flu, but it's definitely not a flu. It's probably better to think of it as like a viral pneumonia. So if you get it, there's a good chance that your lungs will shut down and you'll need serious care, ICU care, intubation, and the fatality rates are definitely higher than the regular flu. I think it's a very dangerous virus too, because it can spread asymptomatically. So you could be carrying it and not know that you're carrying it, which helps it transmit. And given that the world didn't take it very seriously initially, that's kind of why it got to the point where it is now.
Yeah, what do you think the death rate is? Because there's a lot of different numbers floating around. What's your take on that?
It's definitely hard to gauge exactly what the death rate is, because different countries have different situations, different socioeconomic criteria, where you might not have the medical care, or you do have the medical care but you don't have enough infrastructure, or you're not able to get it under control by putting limits on population movements. So I think it's going to be different everywhere, and also the demographics of the country too. So Italy skews more towards towards older people, so of course they will have more deaths, and also reporting on how on what is actually a COVID-19 death. So I think some countries are reporting it's a COVID-19 death even if you were already sick or you had a heart condition and you died of COVID-19. But I think without a common standard of how to quantify a COVID-19 death, it's definitely difficult.
So getting back to my other question, do you think these numbers have been fuzzied by the Chinese government at all?
It's hard to say. I mean, you have the same issue, like different places in China will report differently based on different criteria. And until there's like a unified criteria, it's hard to say. I think right now you don't see any new cases of COVID in China. And I think, that's questionable, because it's likely there are, but it's also complicated because you have now people going back to China and importing it back, even though they had it under pretty good control, because, life in China has basically gone back to normal. People are going out, malls are open, restaurants are open. You still have a lot of people wearing masks. You have to wear a mask when you're out in public, but for more or less, it's okay now. But you do see a rise, and I think they recently blocked international travelers from going back to China, so that people that had left China to escape don't bring it back with them when they come back. So that is another reason why it's going back up.
Yeah. Okay. So let's take one step back before we get to the current situation. So there was a big lockdown of Wuhan, and I think also of other parts of China, right?
Mm-hmm.
And what did this lockdown look like exactly?
Right. So I think in the city center of Wuhan, like the densely populated city part, it was definitely like you couldn't leave your apartments. You could go out to buy groceries at some time, but then it kind of was ramped up more, so that you could only order groceries and stuff from your apartment complex. In Chinese, it's called 小区. It's like your little complex. So you'd have to get together with everyone, place your group order, and then you kind of settle up amongst everyone afterwards and grab your groceries or whatnot.
So hang on. People weren't even allowed to leave their home for groceries. They had to order in groups.
Yes, that was during the most severe part of the lockdown. But for other parts of China, like say Shanghai, it's more open. So you could actually go out you'd have like a ticket system where you have to get a piece of paper from your complex and then let them know when you're coming and going. And there's always monitoring of people wearing masks or not, and when you're outside. So it's I mean, you've seen some videos like from Argentina where they had like a squad of people chasing after people out in public, right? I don't think that was the case. It's more like if you were not wearing a mask, you would get fined for not wearing a mask, and then if you really resist, then they'll probably do something. But generally people are wearing masks because everyone doesn't also doesn't want to catch the disease, so everyone's very cautious as well. But yeah, like there was not I don't think there was such a countrywide lockdown as you're seeing in Italy, where personal travel is restricted and whatnot. Borders definitely were closed. um, Public transport is closed. There's a major reduction in flights, but for the most part, you can still go out and about, but a lot of people choose not to go out just because they don't want to get sick.
So what kind of penalty is there, for example, in Wuhan, when you weren't allowed to even leave your apartment? Like, what happens if you do leave your apartment? Do you have any idea?
I don't know that part because everyone that I know was following the mandate not to leave, and there is a big incentive not to go out because you know that the healthcare infrastructure is strained. So the aunt of one of my employees actually caught COVID, and it was very difficult for them to call an ambulance to get her. In the end, they had to take her to the hospital themselves, and it's just depending on yourself. So
Just
if you
because
can,
there weren't enough ambulances, or what was the
yeah,
reason?
definitely. I think that was a like strained healthcare infrastructure is a major common thread everywhere. And that is a big driving force for telling people to stay at home and reduce transmission rates.
Yeah, and apparently they built a whole new hospital for COVID in like a weekend.
I think they built 2 hospitals, a third later, but the first one was done in 10 days with 1,000 beds, and the second one was done in 12 days with 1,500 beds. But those hospitals were for like confirmed cases or people that are very sick. Like typically, if you're not that sick, you would just go to the normal hospitals.
I've seen pretty crazy videos online of like people being wielded in their apartments. Do you think that these videos are legit?
I don't know. I haven't really dug into that, but they're probably real. But it's hard to say what exactly it is. They could just be welding some of the exits shut, so there's only like fewer exits that they can monitor, because they do need to monitor the coming and going of people. And yeah, it's hard to say exactly what was happening without being there.
Yeah. So apart from that sort of full lockdown, I've also heard that just in general in China, there's a lot of testing. Like every time you enter a mall, your temperature is taken, and every time you enter a bus or a train, whatever, these kinds of things. And then if you do have high temperature, you're just immediately taken to some separate quarantine building, or what does that look like? How does that work? Do you know this?
Yeah. So after the SARS outbreak, I think in 2003, China's like pretty prepared for dealing with major viral outbreaks of this like and major contagions. So you have things like the temperature checks everywhere. So the airports, they have those thermal cameras to detect if you have a fever. And after SARS, they kind of still have them there. So it's not like they can't put it back, right, and turn it back on. I don't think they were active for a long time, but definitely all that infrastructure is in place. So train stations, airports, major places where you have people coming and going, they do have those thermal cameras. A lot of the malls and office buildings, they actually have that infrastructure in place too. So they have ways to take your temperature. They have all the sanitation equipment, masks, gloves, everything. And it's a very robust system, so it's able to kick into high gear when it's needed. And I think it's the same for like Singapore, for Japan, Korea, Hong Kong, Taiwan. They all have it in place, ready to use when it's needed to be used. And that's kind of a failing, like when you compare it to the West, like Canada and the US. It's like we have nothing here. You also have masks being rationed. So Taiwan, I think, rations their masks. They sell it to the populace, I think, for very cheap. In China, like even our office building for Pixelmatic, they actually give you masks every week. So you get one mask per day. And there is like a government program where you can buy masks too, and they control the price, so it's not crazy price gouging. And I got some numbers here. So the surgical masks in China are going for about 63 US cents right now. In Canada, I think it's about $1.25 US. N95 masks, we can get them in China for about $1.80, and in Canada they're selling for about $6 US.
Right.
But it's also very hard to get, but you can get them readily in China. It's actually very easy.
Well, so, and I guess I think the other big difference is that if you do have a fever, from which shows on one of these cameras, you're being taken to a separate hotel or a separate area immediately, or you're not allowed to go back to your family, for example. Is that true?
Yeah, I think in general they have the infrastructure to do that, to quarantine people outside of their families, and that's also something that's lacking, I think, in Canada and the US, which is, if you're sick, there's no designated place for you to go, and you just kind of have to hole up with your family. And also, like you mentioned, there's a definite lack of testing. And I'm not sure exactly why, if we don't have the kits, or if it's regulations preventing kits from being made, or their government is unable to buy kits from other countries, or what. But there's definitely a massive lack of testing, and that's really hard because of the asymptomatic transmission of the disease, which is pretty bad. So if you can't test and people are walking around thinking they're fine, that's pretty bad.
Yeah.
Right now, if before the lockdown of international people going back to China, they were actually testing everyone that came in for COVID. So if you got to the airport, they would check your temperature, take you to a facility and test you actually, and then release you to a quarantine hotel where you have to stay for 2 weeks.
How do Chinese people deal with it? I've seen videos from Wuhan where it seems like the people aren't actually happy with how the government has been dealing with the situation.
Well, no one's ever happy with how the government deals with it, because the governments usually deal with it very poorly, right? Like, compare private industry and public industry, right? But yeah, like, there's a lot of people upset that it wasn't dealt with sooner, right? And there's a lot more things that could be done, but it's difficult to kind of rate China because that's where the outbreak initially happened. So people have no idea what's going on. But for other countries nearby that had advance warning, like other Asian countries, they were able to jump on it really quickly and contain it. And then for the Western countries, it's really just they have no idea what's going on and no ability to react even.
Why?
Just because they haven't had to go through it, I think. And if we can contain it this time, I think the next pandemic, everyone will be better prepared. Like, Canada had masks, but they were all expired, and I don't think we have any production facilities making masks either. And there's a lack of culture to wear masks. And you can debate if masks are effective or not, but there are some studies out there that say masks prevent 90% of droplets, and that's better than zero.
Yeah. Hang on, before we get to China or Canada, and I do want to get to Canada as well, but
right.
In Wuhan, maybe the Chinese people aren't very happy with how it, because how it all played out, how the government stepped in too late. But maybe in the rest of China, because of the strict lockdown, the virus couldn't spread as much. So I can imagine, and maybe this is wrong, but I'm curious to hear your thoughts on this. Are people in Shanghai, for example, maybe much more positive about how the government acted, or in Beijing or in other parts of China compared to Wuhan?
I would say yes. I think lockdown of the entire province where the outbreak happened definitely helped. And, it's just really containment. And I think that containment was good because it meant that other parts of China were not as hard hit. But there's definitely some stigma, like, there's some racism against Asians in the West, like, for having the virus, or people think they have the virus. But even in China, there's some stigma for people from Wuhan, or from the province, and they just think like if you're from there, you have the virus, or they blame them for having the virus too. So there's a lot of complexities around it.
Yeah. If I just ask you about your thoughts, about your opinion about how the Chinese government dealt with it, do you think they did the right thing, or what's your thoughts there?
Well, I think restricting the information initially was probably the biggest misstep. But after they did the public uh, announcement that this is a major virus and there is human-human transmission, I think they took a lot of steps very rapidly to contain it. And you can argue with their methodologies, like locking down the province or locking down the city, but the bulk of China was able to move around freely. Like it wasn't that everybody had to stay home. And they did produce masks and make sure that everyone can get masks. So I think that was another big positive, because now life is back to normal. I would say China is about 70% back to normal operational capacity.
Mm-hmm.
And I mean, that's going to make things better for their economy, unlike total shutdown of everything.
Yeah. So according to the latest, the current Chinese situation, I haven't checked today, but at least for the last couple of days, there were no new cases at all, according to the official numbers.
Yeah.
At least. Do you think this is this true? Are there no new cases in China at this point?
Well, I would look at all
Wuhan,
the numbers. Like I think Wuhan is actually, I would actually believe it if there were 0 cases, because everything was locked down and you can't really move or do anything there. So it's highly likely. But I think for the rest of China, there are definitely cases, but it's also a matter of like, can you test? And I don't think you can rely on any numbers anywhere unless you have perfect testing of everybody. So I would take every number from any country with a grain of salt.
Yeah. All right. So let's get to. You're in Canada right now. You're in Vancouver,
Yeah.
right?
I'm in Victoria on the island next to Vancouver.
Oh, nice. I've been there 10 years ago, I think, to the island. Anyways, so what are the biggest differences you're seeing between the Canadian approach and the Chinese approach?
Let me think. So I think we started taking some measures about 2 weeks ago. You started seeing some businesses close. So like Blockstream, we have an office here. We decided to close the office and just to take a preemptive measure. And then about a week after that, you saw kind of restaurants closing, non-essential services, grocery stores restricting their hours as of this week. So today
did this happen because the government or the local government said they had to close, or did they close voluntarily?
Yeah, so local governments, and then I think this morning the provincial government of BC, like they're trying to unify all the different policies of closures. So they're overriding the municipal governments and issuing their own mandates for province-wide guidance. But I think now we're taking it seriously, but still we're missing a lot of key parts, which is ability to test and get masks. So I have a friend whose wife possibly could have it. She's been very ill, but she's also unable to get a test. So there's definitely a shortage of testing, and also masks are not being worn, and it's also very hard to buy a mask here. I think you can buy them from Amazon. They're marked up heavily, but there's no like distribution from the government or any programs to buy from the government.
Yeah, is the situation getting bad in Canada at this point, or for example in the hospitals, or?
Well, there's definitely, you see doctors posting videos about how bad it is and warning people that things are going to get bad. But from what I see, we're so far okay-ish in Canada. Like, I think our R0 is lower in Canada just because we don't have as many dense population centers. You have Vancouver, Toronto, Montreal, but for the most part, we're pretty sparsely populated. Everyone's pretty spread out, and combined with people staying at home, like we're not under lockdown. We're strictly encouraged to stay at home, but even with a reduction of people going out, that will help a lot just because we're already very sparse.
Are people doing that? Are people listening? Are people taking it seriously? So not just the governments, but just the people in your town, city, in Canada?
Yeah, I think so. Like businesses closing definitely helps a lot because there's nowhere to go. You still see people out and about, and people are maintaining social distance. So trying to stay 6 feet or 2 meters apart from one another. The measures that came down today will probably encourage people to comply more. So I think you can get fined upwards of 25K Canadian if you're reselling food or cleaning supplies. You can also get fined or go to jail for 1 year. But for movement, I think generally people are pretty compliant, and if people go out, they try to maintain a distance. I actually went to the grocery store yesterday to pick some things up, and they marked off like lines in the lineup, so you have to line up spaced out. I guess that helps with people fighting, because if it's kind of you're guided to stay away from each other, you kind of are more likely to do it, rather than relying on people to decide for themselves what's the right distance. They're only letting a certain number of people into the supermarkets at a time, and they're disinfecting the grocery cart handles. So, I think private businesses are doing quite well, but at the government level, I don't think we're mobilized well at all.
You think it needs, yeah, and that's because of masks, mostly.
Yeah, I think largely it's masks and distributing masks. But there's not like a big campaign to do disinfection or anything like that. So, transmission through door handles, doorknobs, or surfaces people touch, all that is just as it always has been.
Yeah. Do you think Canadians even would wear masks?
It's a difficult one. I read a story about Toronto where some Asians went to the supermarket and wore masks, and they got insulted and yelled at by other people in the store. And it doesn't seem like it's a social norm. People will think that it's kind of stupid, but people will think that you are sick instead of you're protecting them by wearing a mask. And yeah, but I think masks definitely are a major part of the equation for containment. Like, there's no reason to tell people to stay at home if you're, one, disinfecting public spaces, and two, have people wearing masks. Like, if you just look at Asia as an example of how to get the economy back on track, that is the formula. Otherwise, everyone's just locked up at home, nothing is open, no one's going out, and economy will tank.
Yeah, what you're saying is that it's better to do it well for a shorter period of time than to keep dragging it along.
Yeah.
I would agree with that. I'm not sure why policymakers in the West seem to be choosing this dragging along strategy. Do you want to speculate on that? Because I don't get it.
I think it's really they don't have masks, and they don't have production facilities to get them, to make them, and they just don't know what to do. And the only thing they can do is say, stay at home. And if you want to get more draconian, it's like, you must stay at home.
Yeah. Do you think there's any denialism going on still? Because you've been following this since January or something like that, and I think in the early weeks, especially until like you said, 2-3 weeks ago, there was a lot of denialism, and I think that's sort of dying down. Or do you still see that around you?
Well, I still see a lot of it. People are saying it's not that bad or whatever, but it is definitely bad, and it just takes time for people to understand that. Like, people need to see it anecdotally, like from their friends or friends of friends, or hear local stories about people suffering in their own communities before they really get it and it hits home.
Yeah. Okay, I think that's it, Samson. Is there anything else you want to add? Is there something we should have discussed which we haven't yet?
I don't know, there's lots of things to discuss.
Like what?
I don't know, like Bitcoin's role in it too.
Yeah, let's keep that. I was thinking maybe we should do another episode on that. I wanna
All right.
drift my podcast more towards Bitcoin related content over time because I think
Okay.
it's gonna be very relevant, or I think it could be very relevant.
Yeah.
Yeah. So let's save that for now. And
Sounds good.
so for now, Samson, thanks for being on.
Thanks, Aaron.
Stay healthy.
Yeah, you too.
Take care
Stay
of
safe.
yourself, and
Yeah.
thanks for your time.
Thank you.